To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about metabolic syndrome. We're going to tell you what that means because I'm joined by Dr. Tracy Page from Wisconsin Institute of Functional Medicine. Hi, Tracy.
Good morning, Brian.
Well, we're going to show them something in a minute, which is why I don't have the sleeve down, but maybe we should just tell people what metabolic syndrome is and why it's important.
Yeah, so the majority of the patients that we see are suffering some type of metabolic syndrome, which means that they're not regulating their blood sugar appropriately. So that leads to feeling tired, foggy thinking, brain fog, lack of energy, fatigue, even inability to lose weight.
Yeah, it's finding that balance, and that's what you do, is you help people find that balance. So whatever that goal is, maybe it's staying off of medication, or maybe it's losing that weight, that's what we do it. So when we think about that, how do we treat an imbalance, or how do you recognize an imbalance?
So metabolic syndrome is where we're not using our blood sugar or those nutrients correctly. So think of like a car and the engine. So if we're flooding it full of gas all the time, the car's not going to work appropriately, right? Sometimes it doesn't even start if we do that. So if you have metabolic syndrome and you're not utilizing the nutrients that you're taking in, it's going to lead to inflammation and weight gain and foggy thinking. So what we do is we want to figure out what your blood sugar is, and we can use a continuous glucose monitor, so we can actually specifically for your body know exactly how do you metabolize the foods that you're taking in, but also how does stress affect your blood sugar, how does sleep affect your blood sugar, movement, because in that way it gives a lot of feedback in order to get you on the right track to make sure that your engine is running smoothly and that your body is optimized.
And you have those results at your practice in real time, but if I sync it to my phone, I have it in real time as well.
Yeah, so you can actually sync it to your phone on an app, and you can actually measure, and you can put information in. So if your blood sugar spikes more than 30 points over normal, you'll want to put in there what's going on for you. It could be stress or something going on, or it could be some food that you took in. But we also, you can sync to our dashboard, and we can give you feedback from a medical standpoint of what we would do once we get to see your data over a couple weeks.
Well, should we show them how easy it is to do
Yeah,
it?
it's super easy.
All right,
so,
let's do it.
Yeah, so this is just a simple monitor, and we're going to put it against the skin here, and then I'm just going to push down, and you're going to hear a little click here, and that's it. And then it's on, and you can show it actually, so you can see it's
Look
a
at
small
that.
little device that sits on the back of your skin. Did that hurt?
No, not at all. Didn't even feel a thing.
Yeah.
So as we wrap up, it's so easy to get these. Come in, find out what's going under your hood so you can make the changes.
Yeah, specifically for your body.
All right. Well, Dr. Page, thanks so much for being here and kind of helping us through the metabolic syndrome.
Yeah, you're
and
welcome.
we want to thank you for watching To Your Health.